and good evening. I'm Melissa Idris. You're watching Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. The Health Ministry is currently looking into whether or not Malaysia should legalise medical cannabis, with a decision set to be announced before the end of the year. This after Health Minister Khairy Jamaluddin visited Thailand last month to learn from their experience. The country was the first in Asia to have legalised the use of medical marijuana in 2018, and then the cultivation and possession of cannabis in June of this year. Around the world, more than 40 countries have legalised the consumption of cannabis for medical purposes. Is Malaysia prepared to join them? My guest today is Dr. Nur Azalia Kamarul Zaman. She's the director of the National Poison Centre at University Science Malaysia. Dr. Azalia, thank you for joining me on the show. Can you begin our conversation tonight by helping clarify some of the common misconceptions? I think one of the most common mistakes we often make is we use cannabis, marijuana, and hemp all interchangeably in our conversation. And I'm wondering whether you can talk us through what the differentiations are. How do we make the distinction between cannabis, marijuana, and hemp?
All right. Okay. Thanks, Melissa, for having me on the show. It's great to be invited. So you brought up a good point there, Melissa. I think this issue of cannabis, hemp, marijuana, this is the most important question for us to address. It's the very basic step, and this is the point whereby people get confused. And when people get confused, and when they misunderstand something, they perceived, oh, that's where stigma comes from, right? Okay, so to start off, okay, you have cannabis, you have hemp, you have marijuana. To put simply, all right, cannabis is a broader classification of plants. So marijuana and hemp are a type of cannabis. So it's kind of like it's the family. That's why it's an umbrella term for all of these plants, right? It's the genus. So from there you have cannabis, and then cannabis is divided into two species. So you have two types. You have marijuana, what people mostly call them ganja, weed, pod, all those things, and you have hemp, right? Hemp. Okay. Now, what differentiates between these two is the level of THC, tetrahydrocannabinol, right? Now, in a cannabis plant, there are hundreds of phytocannabinoids, these are compounds which are available in the plants. But the two common ones are, like I mentioned, THC and CBD, cannabidiol. Okay. Now, THC, when you talk about getting high, when you talk about having euphoria, and you talk about psychoactive effect, that is THC. No doubt about that, because it is well known to have psychoactive effect. So it makes sense. Now, marijuana has a lot of this THC. A lot of THC, 10 to 20%, and it has CBD as well. But when it has a lot of THC, that's when people get high, people take them. Understandably so. But hemp, on the other hand, now that is a different story. Hemp has less than 0.3% of THC, and it has a great deal of CBD, cannabidiol, right? So when you have something that is less than 0.3%, you can take it all you want, you don't get high, right? And it has a great deal amount of CBD. Now, cannabidiol is well known because it is non-psychoactive and it elicits a whole lot of medical benefits, right? So what differentiates between these two are the amount of THC, basically. If you are 0.3% and below, you're hemp. But if you are even 0.5% and even higher, then you are categorized as marijuana. Okay. So right. Yeah, so you can say that marijuana is the intoxicating cousin of hemp. And all of this we're talking about here, we're talking about cannabis.
Okay, all right. So the cannabis plant, and we have the different types. So we have hemp and we have marijuana. What differentiates them is THC and CBD. I do want to ask you, when you know in the misconception, it's not just a kind of public misconception or the way we kind of confuse all of these terms together. The legislation doesn't make that distinction either, right? So all cannabis is categorized, is banned. There's no distinction under Malaysia's act, correct?
Mm-hmm. Yep, you're right. under Akta Dadah Berbahaya, Dangerous Drug Act 1952, it clearly states that cannabis is illegal, right? You cannot possess it, you cannot plant it, you cannot have anything to do with it. So you can see that there is a blanket ban, isn't it? There's a blanket ban. It is the notion of Dangerous Drug Act is that you ban something because it has psychoactive effects.
Okay.
Right? You have psychoactive effects because you have opioids in there as well. So it's related to all of these dangerous drugs which have psychoactive effect. And they put the same statement, or rather the same notion for cannabis plant. I believe that they get confused with the fact that, oh, it's cannabis, you get high, it's psychoactive, we ban it, it's a dangerous drug, right?
Okay.
But if you truly understand about hemp, then you know that hemp is not at fault. It is not psychoactive at all. So to put it in the same category as something that is dangerous and psychoactive and causes you high, so there's a little bit of, I would say, a bit of injustice to the plant itself.
Okay, so can you explain the term medical cannabis? What does that often refer to?
Okay, so medical cannabis is, to put it simply, the use of cannabis for medical reasons, right? And that is actually a lot of countries all over the world are slowly softening their tone on cannabis for medical reasons. Not many for recreational. We have Uruguay, Canada, and a few states in the United States, and a few states in the European countries as well. But a lot of countries, other countries, Australia, New Zealand, they they legalize cannabis for medicine. So you are pretty much legalizing the use of cannabis solely for therapeutic effects. So these can include, when you talk about medical cannabis, this can include both hemp and marijuana actually, because true, hemp is one, but don't get me wrong, when I say that THC it's making you high, this and that, but the THC also has its own benefits as well. Because it's like CBD and THC, they have their own properties.
Right.
Sometimes they work well on their own, sometimes they work well together. But it's easier to put THC out of the picture because it makes you high.
Okay, so medical cannabis would be used like prescription drugs. It would have to be prescribed by a medical professional, and therefore the use of it monitored, but also the distribution of it will have to be regulated as well. What kind of products are we talking about? I mean, I feel like many of us in Malaysia only think about cannabis the way it's portrayed in popular culture. But what does science say about who it will help and what kind of products this involves?
Globally, there are about 5 commercially available drugs right now which are cannabis based. So they are prescribed for various health indications. You have Epidiolex, one of it, which is prescribed for very rare versions of childhood epilepsy, right? And you have a few other drugs which are meant to treat spasms in patients with multiple sclerosis. Or you have drugs which treat the pain and nausea, which are related to the drugs of chemotherapy and HIV. So you know that actually there are pharmaceutical drugs out there which are based from cannabis, which are prescribed to patients who need them.
Right.
Yep.
Okay. All right. Dr. Azalea, you have highlighted in public forums before some of the challenges that local researchers from public universities face in trying to study cannabis. Can you reiterate what those challenges are? Share with us what does that mean? How does that impact local research on medical cannabis?
All right. So I don't know what other researchers are going through. So what I can speak is solely from our experience, what we had gone through, right? So is from our part. So this project is something that we had been passionately pursuing since 2018. Right? We see a lot of potential in it. We see a lot of medical potential. It's never been studied in Malaysia. It can reap a lot of economic benefit as well to Malaysians. So we've been pursuing it. However, we do encounter hiccups. We do encounter hiccups up till today, whereby apparently there is a distinction of how do you say this? It's in Akta Data Mabaya in Dangerous Drug Act Section 6B2, it says that the Minister of Health can give the permission to a public officer to conduct cannabis plantation or cultivation for the reasons of medical, research, experimental, and educational. Okay. So based on that, we wanted to pursue this initiative. However, because of the difference in terms of that public officer, we could not pass that, right? So of course, that is the hiccup that we are going through right now.
Right.
As a university staff, we are stopped there. Okay. However, we're not giving up. So what we are doing right now is that we're making another effort to collaborate with the said public officer, right?
Okay. All right.
Yeah. So that's how we have to kind of maneuver your way to kind of make to do this research legally.
Right. But research on medical cannabis and cannabis as a whole has been done worldwide. What is it that we need to look at from a local perspective?
Okay. We feel that we need to understand that. You're right. The research on cannabis has been done worldwide. However, I feel that perhaps Malaysians need a more comprehensive data, perhaps local data, to feel more confident about the entry of cannabis research in Malaysia. Okay. However, I do feel that rather we can amplify the research rather than repeating the same research that has been done internationally. Like I said before, these drugs have gone stringent processes. I feel that sure, we can take some of the data and we can amplify that rather than start from scratch. Someone else has done it. We don't need to replicate. Maybe we can study in depth. Enrich the data, enrich the available data, local data, sure.
Yeah, especially you're right, for a local context. Dr. Azalea, we're going to take a quick break, but let's continue our conversation in just a couple of minutes. Stay tuned to Consider This. Hi, thanks for staying with Consider This. I'm Melissa Idris. Let's continue our conversation with Dr. Nur Azalea Kamaruzaman. She is the director of USM's National Poison Centre. We're discussing medical cannabis. This after the Health Ministry says it is currently looking into whether or not Malaysia should legalise medical cannabis, with a decision set to be announced before the end of the year. Dr. Azalea, Thailand has legalized the cultivation and possession of cannabis by removing marijuana from its banned narcotics list. This was in June of this year. I think about 4 years ago, they legalized medical cannabis. Now that we have a neighboring country with some experience, what would you say are some of the lessons that we can take away from their experience?
Right. So, Thailand is the first. You're right. Thailand was the first Asian country to legalize cannabis for medical purposes, and I feel that it is a stunning U-turn for a nation that has one of the harshest drug laws in the world. Right. So I believe that Thailand saw the potential in cannabis in terms of both medical and economic benefits. As you mentioned earlier, our health minister had gone to Thailand for a visit quite recently, right? So I feel that you feel that Thailand had done rigorous planning, and they have done good amount of regulation to control the cultivation and research of cannabis. Even though they allow their citizens to plant their own cannabis plants, they even give about 1 million plants to their citizens, right, to grow at their own home, but they are able to trace them in a way that, for example, let's just say that you're given about 6 plants. Therefore, when they monitor you, you're only allowed 6 plants. If you have 7 plants, then there's something wrong. Then you are not obeying the law. So even though they give the freedom to the citizens, they ensure that there's a certain level of monitoring, regulation, and surveillance to ensure that the illicit market is not penetrating their system. Okay. So, and even so, if you see right now in Thailand, a colleague of ours, he went to Thailand. He said in 7E you can see a lot of cannabis infused drinks, bubble tea, energy drinks, even tom yum, right? But the Thais, the cannabis plants in Thailand are regulated, so they are hemp essentially. They have less than 0.2%, not even 0.2, I believe 0.2% of THC. So everything that they ingest is not THC based. So it's meant for health, right? So it's not supposed to be psychoactive. A colleague of ours, he went to a university in Thailand recently, North Thailand, to visit a cannabis facility, right? And it was really an eye opener to have the facility located at the top of a roof, and it was triple fencing. Even prison is not that strict. It's triple fencing, and you have everything being tracked from seed to plant to production. Everything is being traced. Of course, you have the alarm system. You have access card for CCTV. Access card. You have CCTV, and the plants are controlled very, very strictly. The water is filtered, the air is controlled, the amount of sunlight also is controlled. So you have a very high quality pharmaceutical grade cannabis plants.
Right.
So yes.
Sorry to interrupt, Dr. Azalia. Is there a difference between legalizing medical marijuana and the import and the prescription of such a drug versus what Thailand has also done, which is allowed the cultivation of a drug? That's not of cannabis. That's not what the Malaysian Health Ministry is looking at. What is the distinction to be made between allowing for or legalizing medical marijuana or medical cannabis versus cultivation of cannabis?
Right. So when you cultivate cannabis, you can plant it, but planting it has its own purpose. When it comes to cannabis, health is not the only thing that you can get from the plant. You can have industrial fiber as well. You can gain fiber from them, and the fiber from the hemp plant can be used for many things. You have clothes, paper, right? So all of these brands, Nike, Adidas, they even make shoes out of this hemp fiber because they are very, very strong. So you have one side of it, and hemp seeds, right? Okay, because the CBD oil, they come from the flowers, but if you have seeds, the seeds can become some sort of superfood. It's actually a well-known vegan superfood. It's like a cereal, right? And the hemp seed itself, it can be developed into butter or margarine or other lotion or skincare products. So there's a whole lot of properties of a cannabis plant that you can use. But if you focus it on medical, and if you want to plant it for medical, then that is the stance that you have to follow.
Okay, all right. So there's an entire industry that can surround the cultivation of cannabis. How would you respond to critics of Thailand's move to legalize medical cannabis, to allow for cultivation and possession? They say that, well, it's actually not just for medical or industrial purposes, that the lines are blurred, that it also allows for recreational taking of cannabis. How would you respond to the countries or the parties who criticize Thailand's move, saying that it's actually turned out to be a bit of a mess?
Right. So there are many sides of the story. If you read one thing, something this controversial surely will elicit a lot of emotions in people.
You're right.
And so it's really difficult. I mean, the possibility is always there. The possibility, because when you let loose, when you allow people to grow, of course, people are very concerned because the potential of recreational use to be penetrating into the system, understandably so. As far as we believe, as far as we understand, that is not the policy that the Thais are proposing. They clearly state, even is out there, tourists do not come to Thailand for recreational use. So they want to promote cannabis plant for health, and they control the plants, right? If let's just say that there is indeed a leak of marijuana, then there should be a proper regulation. The control has to be truly stringent. So let's just say if Malaysia is indeed looking to emulate Thailand, you should learn from their successes, and if there are their failures as well.
Okay.
Right?
All right. Okay.
Yeah.
So on that note, Dr. Zalia, what if this is something that the Health Ministry is looking at? They say they are looking at whether this fits into Malaysian society, what the science and data and evidence says. What needs to be in place before something like medical cannabis can be allowed to be prescribed to Malaysian patients?
Right. So, so we're talking about prescription, yeah?
Yes.
Prescription
So
of medical
for
cannabis
medical
to
cannabis,
patients.
correct. Mm-hmm.
Right. When you talk about prescription, the healthcare professionals need to be confident about this. They need, because at the end of the day, when we're talking about prescription, the healthcare professionals, the doctors, the pharmacists, they are responsible for prescribing these drugs to the patients. So I feel that the first step is to do extensive research in terms of efficacy and safety. When the healthcare professionals are confident with science, the data given, then they would be more at ease at prescribing such medications to the public.
Okay. And what about education of the public in terms of the benefits and the dangers or the limitations of medical cannabis? Who should take the lead, in your opinion, Dr. Azalia? Because it would require, as you mentioned a bit earlier, this topic tends to stir out a lot of debate and has a lot of stigma attached to it. So educating the public needs to be led by an institution that enjoys high public trust. What are your thoughts on the ways that the Malaysian government can go about doing this?
All right. So yeah, as I go back to the very first question, the misconception itself is the key for the public. Yes, the public needs to understand. However, the public are smarter. The public are smart people. They read more than we do, and they are very open. I've talked to a few people about this. I've given talks, and after we explain to them, they just feel that why is it still banned if you make them understand, you know.
Right.
So the public are very perceptive, very open, and very much looking into the potential. So yes, it is very important to educate them, remove the stigma. Who should be in charge? Well, I think it should be a collective effort, but it all begins with the policymakers.
Right.
Because we can talk all we want, we can try to give education as we want, and like what we are doing today, right? We're disseminating knowledge, but it all leads to the policymakers to determine where this plan is headed in Malaysia.
And on that note, where do you think policymakers should be? What do you think policymakers should be focused on? What would you like to see happen next?
Right. Okay. So there are quite a few steps actually. I mean, but it's good. It's good that the first step had been to look at the country which is doing it right now, which is gaining popularity. Well, mostly in good terms, some in bad terms, sure. So it's good. I think the policymakers should ensure that if this plant does go into the legalization process, there needs to be a clear policy, a clear stance on what we believe, right? And there should be a proper control. You need to be able to trace it from seed to plant to manufacturing to product. And to do that, you need to utilize the various technologies that we have. You know, you have to utilize AI, blockchain, Internet of Things. You need to be able to use all of these scientific advances to be able to make sure that every milligram of the plant is accountable for. Right? And last but not least, of course, the healthcare professionals need to be educated, and the public also must be led into a more accurate knowledge system. Yes.
All right. Well, thank you so much for speaking with me tonight and sharing some of your knowledge and your insights with us. That was USM's National Poison Center Director, Dr. Azalia Kamarul-Zaman. That wraps up this episode of Consider This. I'm Melissa Idris, signing off for the evening. Thank you so much for watching, and good night.